Hey,
How's it going?
I'm good. How are you?
Good. I'm here with Brandon Saenz. And Brandon, will you tell us your title, please?
Yes, I am a doctor of nursing practice. That's a complicated way of saying I'm a nurse practitioner who can't do any more school because I got a doctorate. But I'm a psychiatric mental health nurse practitioner.
Amazing. And where did you go to school?
I went to my undergrad was in Pace University, um, but I did musical theater first, and then I rerouted, and then I got a second bachelor's in psychological science from the University of Arizona because I had to do a bunch of prerequisites because they didn't accept my TAP final to cover my chemistry credits. It was crazy. So I got a second bachelor's degree in psychological science, and then I went to nursing school at Columbia. I moved back to New York, nursing school in Columbia, and then I finished my doctorate from Columbia um, a little over a year ago.
Amazing. Amazing. And how do you like living in New York?
Love it. It's the greatest city in the world. It also is draining my wallet and my will to want to keep living here, but I do love it. Yeah.
Yeah. Well, we can see a little bit of your amazing view. Lovely, lovely. And how long have you been there?
Um, but between undergrad and now a net of like 9 years, but I worked on cruise ships like in the middle there, so I don't count that interim. But from when I was there then to now, yeah, total of like 9 years.
Okay, so you're a New Yorker.
Thank you. I heard some random like arbitrary number was 14 years, so
Oh,
I don't know where that came from. I think the consensus though is 10, so I maybe will
okay.
claim that title at 10 years
Yeah. I was never there for 10, but I still considered myself a New Yorker. I think it's just a vibe.
because you're street smart.
Yeah.
You picked
Yeah,
up.
I would like strut around,
It's the best.
just like look for celebrities. Were you there during COVID?
So I started nursing school during the pandemic. So
Okay.
I was here when things had calmed down actually. So not the height of the pandemic, like early on when it was really scary, but when it had chilled out a bit and they were allowing us back in the hospitals, then yeah, I was here late 2020.
That's wild. What were the protocols when you were in school? Like, were you able to see patients or was a lot of it virtual?
That's a great question. So initially, our first semester was not supposed to be, but it was remote. So
Okay.
we learned physical assessment on this stupid online system. But I had a medical background, and my I came from a medical family, and I was working as a nursing assistant in inpatient psychiatry. So I
Okay.
was utilizing kind of what I was learning in person and doing it softly, like in the hospital. Um, but then when we got to New York and actually started clinical, then it was tight. We had full PPE protocols, like certain patient populations, like we couldn't be with, like people who were COVID positive. And they tried to maintain that, but just too many people were sick and needed help. So then we were kind of they kind of lessened that for us, and then we were yeah kind of in it.
Wow, that's wild.
Yeah. Mhm.
And I think it says a lot about your perseverance that you stuck through that. I'm sure it was really challenging and like probably not fun at all.
It was definitely something that bound us all together. Like we like fondly refer to each other as the COVID cohort. Like we were the ones that started because the cohort before us were flung into the pandemic, and then we knew that it was happening. So we had a little bit of attrition right in the beginning where a handful of people dropped. They're like, this is not the right time.
Yeah,
But then those of us who stuck through it, we had that togetherness of being like, we got each other.
that's great.
Yeah.
There is such a camaraderie about any type of situation where you're in the trenches with people and like it's hard. And I've had that in certain work situations too, where you just like are bonded for life over this traumatic shared experience.
It's true. Misery loves company.
Yeah.
It
Yeah.
does.
But that's good. You made it through.
Yeah, yeah. It's definitely a badge of honor kind of situation. It was tough, but when you get through it at the end, you're like, yeah, I did that, and you have a little bit of pride in what you do going forward.
Right. And did you know that you wanted to be on the psychiatric side?
I did. So I went back to school knowing that I wanted well, initially not sure what I wanted to do. I thought maybe like MD or DO. Originally PA. I wanted to be a physician's assistant.
Okay.
Because I went back to school at 26. Like I didn't want to have to be in school for like through my 30s. So I
Right.
wanted something a little shorter trajectory. But when I got there, I was shadowing at every hospital, doing every kind of thing that I could. And luckily, my brother and sister-in-law are physicians. My uncle's a physician, so I had ins luckily in hospitals that I was able to get in there and see it. And I loved it. I loved it. I loved it. But there was something that wasn't quite right, and it was when I was with my cousin-in-law, my cousin's husband, who was a physician's assistant, and there was a patient that came in, and he had a quick assessment with them. And the guy looked just so dysphoric and depressed, and you could tell he wasn't caring for himself. And I wanted to know everything about him, and wanted to know what was going on, and I just had such an interest in it. And when we left, he's like, "Hey, come over here." He goes to a cupboard and he pulls out a psych med. I don't remember what it was. And he was like, "Yeah, this guy's depressed. Like he needs to be started on medication, so I'm going to start him on this." And he like from a 10-minute meeting, he had determined all of this, which was one, impressive, but two, I was like, well, what about like a psych consult? Like if you're going to be prescribing psychiatric medications to this guy, and he goes, there's just not enough to go around. Like there's just not enough providers for the people who have these needs. So the primary care people, PAs, NPs, MDs, whatever, start to
Right.
manage these illnesses in the office because there's no one to go to. And at that moment, I was like, I want to do that. And then that was like the little bug that kind of propelled. And then then I knew I needed, if I wanted to do it, needed to know what that looked like. So then I started working as a CNA in inpatient psychiatry shortly after that because I had such an interest and I needed to know if I liked it, and I loved
That's fantastic. It's an interesting perspective too, because I think there's a criticism of treatment of any type of, anxiety, mental illness, depression, that we're going to meds too quickly. But hearing that there just aren't enough providers to go around, like, yes, it would be great if everyone could have a psychiatrist that they saw once a week and they could afford that. And they were managing things that way, or they had cognitive behavioral therapy. But like, you see these crisis situations where you just have to treat someone and then hopefully that can give them the spark to get the additional help that they need.
it. Absolutely, and I totally agree. It was actually when I was doing that second bachelor's, I was in a psychology lab. I thought I wanted to get a PhD for a minute in psychology, but no shame to who does that, but it's a lot of behind a desk, it's a lot of research, it's a lot of, and I was wanted to be patient facing, but I met with the psychologist, one of the professors, and she had mentioned about nurse practitioning, but I didn't quite receive it at that point because I said, well, I don't want to put people on medications, and that was the first thing that I said. I don't want to have to do that. And she had said, actually, from what I know, what my sister or whatever tells me is that it's really not about putting people on meds. Sometimes it's about getting them off,
Wow.
because you're right. Like a lot of primary care providers, which no shame, just there's not enough psych providers, but they try to manage these what don't appear to be as acute situations. They do go to medications. Not a lot of therapists to go around. Some people have stigma about therapy more so than medications sometimes.
Right.
And then before you know it, they try to multiple SSRIs. They go to a different class. They're trying adjunct antipsychotics. Like they're just trying to manage an illness. And then when it get to an actual psych provider, then it's like, all right, let's peel back a bit. What did you try? What worked? At what point was that working? Tell me about what your life was like at that point.
Right.
And then sometimes it's about getting them off some stuff.
Right. And how do you decide who gets what? Are there products that you like that you've seen work for more people? Is it based on sort of what's the newest and the best?
I wish it was the newest and the best. I really do. So where I work now is I stayed in inpatient psychiatry. I've done that my entire kind of career change. So I work in an inpatient psychiatric hospital in Manhattan, and I would love to give the newest and the best, but a lot of the times we don't have that medication on formulary, meaning there's not a generic version of it, so we can't prescribe it yet.
Okay.
It's not it's expensive. So it would be unethical for me, although we work with a lot of underserved populations, unethical for me to give this bright, shiny new medication and then their insurance won't cover it, or then they're going to have to pay out of pocket for it. So as much as I would love that, yeah, we don't really get to do that. So the way that we start any kind of medication management is what brought you in here? What are the acute symptoms that we need to work with? And that's step one.
Wow, that's a lot.
Mhm.
Is there anything that's sort of like the gold standard that, for whatever generalized kind of situation they have, that's like your starting point?
For like anxiety and depression, for psychosis, for mania, like those are kind of the broad spectrums of things that we see. So for any of them, or like the most common one.
Yeah, whatever you see a lot.
Okay. So in inpatient psychiatry, the criteria to get them in there and get them admitted, either voluntarily or involuntarily, is they have to be a danger to themselves or others. So whether they say, I feel unsafe, I feel like I might hurt myself, I want to go into a psychiatric unit, then they come to us, we go from there. Or they can be so floridly psychotic, patients could not have a lot of insight into their illness. They're unable to care for themselves. They're erratic in the community. They're delusional and have delusional beliefs that they're paranoid. So they attack somebody. They're a number of unsafe situations. And then two, this is something that nurse practitioners can't do yet. That's actually changing in New York. But then they would be two PC, two physician certification, meaning two physicians would deem you to be a danger to yourself or others, and then you would be involuntarily admitted into inpatient psychiatry. So if they were floridly psychotic, um, and and we had enough collateral for what kind of medications they've gone on before, then I would first see what had they been on before. What I didn't know what I do is so much research like on a person, which is cool, and also just like a lot to have to be real sleuthy about finding information. But
Right.
what were they on before? Did it work? What kind did they have side effects? Um, and then get them and get their buy-in. Will they take it again? If they had tried multiple things and they say I've tried XYZ, nothing worked, then that gets kind of creative. Then I could say, all right, there's more negative symptoms, meaning they're more flat, depressed, not wanting to care for themselves, or there's more positive symptoms of psychosis, which they're delusions and hallucinations. And so I'll break it down that way, and then there's like kind of algorithms. It's a lot of algorithms.
Right, right. Have you had situations where you felt unsafe with
Absolutely,
people?
yeah.
Yeah,
I laugh because you kind of have to laugh in it because
yeah.
yeah, like I had a patient less than a month ago who was so floridly psychotic and manic, was had a belief that people in her building were coordinating to hurt her, were raping somebody in the building. She thought that then her kids were involved in it. Then they were coordinating in the environment. Like when she left the apartment, they were wearing certain colors. She had a whole delusional thought process around feeling targeted by some people, by gangs, really. And she wanted to discharge. She didn't think she had a mental illness. She wanted to go home. And I said, as it's my decision, I cannot discharge you home in this condition. And she called me, and I quote, you little boss, you little baby boss bitch, because she said I looked young, too young to treat her. And then she threw a chair at me. And now we're changing all the chairs on the unit because we've had one too many chairs thrown at us, and they're too light. So we need heavier chairs that people can't just pick up and toss at us.
Oh my
So
gosh.
I'm luckily quick on my feet, very wiry. So we dodged the chair, make sure I got my social worker behind me. We were in a room where we strategically put ourselves nearest the door. So I got my social worker out. There's a panic button on the wall, panic, and she was bugging out. And then we call an emergency.
Wow, that's crazy.
Yeah. Mm-hmm.
I mean, just kudos to you for putting yourself in a situation where you're helping people at, a potential cost to yourself. Like, I think not a lot of people would make that career choice.
Thank you. Yeah, my mom, that's her biggest concern. That's always her biggest concern. Brandon, there's a lot of like unwell people out there. Just keep yourself safe. Keep yourself safe. And I know, of course, of course. One hasn't not that it hasn't bothered me. Like it bothers me, but what bothers me more is just the knowledge that some of these patients are just so sick.
Right.
and they don't know. I think it's the most insidious and scary part about mental illness is insight. They don't know. So
Right.
throw a chair. I will build rapport with you again, and I will get your buy-in to help you the best that I can. And you may not be on my side at the end. You may not see eye to eye with me, but I'm gonna try to help you the best that I can.
Yeah. And I think that all we could ask for if we were ever in that situation is compassion. So it's wonderful that you're
Mm.
able to provide that to people.
I have to check myself, absolutely. Like some of the hardest parts are patient with more, personality pathology, borderline, antisocial, narcissistic, and those patients, though this population could be really hard to work with because they're so keenly aware to you, your insecurities, your nuances, your they can smell blood in the water and they will come for you. These people, they can come for you and they will get right at you and they can get so aggravating because you're wanting just to be like, you're sick, just do what I want you to do. I want to help you. I want to help you. And any moment that I feel that I'm getting to that level, that's when I consciously take a step back and be like, they're it's just as if they had a bum heart or a joint that doesn't work anymore. It's the exact same kind of illness, and they're just trying to live their life.
Right. Yeah. And I think we've all been there on a micro level, like a few years ago I had to do PT for a shoulder injury and they weren't figuring out like exactly what the problem was and I was so frustrated and then they finally sort of was like we're like, we're gonna treat it as if it's this and if that doesn't work we'll try something else. And I just started crying because I was
Mm,
just like in pain and
mm,
I was so like anxious that we wouldn't figure out what it was and be able to fix it and they were like, we're just gonna keep trying.
yeah.
Like they were so nice to me and yeah, I
Mm,
just was like I was crying and I was like, oh, I was scared.
mm,
Because there was like
mm-hmm.
the pain, but then there was the uncertainty of like, are we going to figure out what's wrong with my shoulder? Is there a fix, And yeah, it's even just for a minor thing like that, like it's scary.
Minor thing like that, but a very big thing to you. That
Right.
was obviously something that was affecting you in a way that's become so helpless when someone's like, "Well, I don't really know like what to do next," and you're like, "This is my life. Like
Right.
this is my life." And you said something really really key that I want to highlight is I was scared. I was
Yeah.
scared. A lot of the times, because like anger isn't necessarily an emotion. It's a behavior. It's an action, really, like to
Right.
outwardly express anger. So the emotion most often behind anger is fear.
Right.
Fear, frustration, sadness. So I don't mind getting yelled at by people because I know when that frustration, that anger comes out, I could imagine you're scared. I could imagine you're
Right.
frustrated. I'm not the enemy.
Right. Like you're in your worst moment and you're
Yeah.
potentially trapped somewhere with people you don't know that you don't trust. Like that would be terrifying. Crazy. And you said you lost a patient a few weeks ago.
I did. That was extremely difficult. That was the first time that's happened to me. I obviously work in psychiatry, so I'm mostly spared from having those situations. Um, because I mean, the most common reason providers lose patients um, in psychiatry is they hurt themselves. They kill themselves. They accidentally hurt themselves. They overdose. They some like it, majority of reasons, but they're usually not in the hospital. This patient unfortunately was in the hospital for a very long time. We had a discharge issue that was terrible, and we couldn't discharge him safely. And where our average length of stay is 10 days, this patient was there for 165 days,
Wow.
and he was my patient. Had a lot of other comorbid conditions along with the depression that I was treating. And we have medical providers like medical specialists on the floor, and we all work together on this patient. But yeah, it was one of those situations that I just was so angry at the system. I needed to be angry at something because I was hurt, I was sad,
Yeah.
and frustrated, and I just had thought the whole system let him down. Sorry. it's still fresh enough, but the whole
Yeah.
system kind of let him down, and I have at least a lot of support from friends and family and like mentors on the unit, but so I learned not to take that on as like my like this was not my fault. But of course, in order to try to figure out what went wrong, our brains immediately go to the first thing that it knows, which is what did I do?
Right.
I don't know what everyone else did. I can't prove the whole system. All I know is what I did. So one, it must be me, and two, what did I do wrong? So when I got over that, then I saw this systems issues as a whole, and it became a learning experience. And I hate saying that because it almost reduces this person's life down to a learning experience for me. And I had mentioned to a mutual friend, actually, you know her, but we talked the other day, and she was like, "Brandon, with love, you're not that important." She goes, "You were a part of his story, but you were not the main character in his story."
Right.
And it was advice like similarly that I gave her because she also went through a difficult situation, and I was able to take more of a bird's eye view and be like, "You're right, you're right." Like I can't have this egocentric thinking where I will then take on all of this for myself.
Right. I mean, that's good advice for sure.
Mm-hmm.
Our brains are so insidious because after something happens, we're able to see everything so clearly and like every domino and everything that could have been different, and it seems like there was such an obvious choice that we should have made that would have changed the outcome of the whole situation.
Mm,
But obviously in that moment, like, you don't know that. And I think for most of us, we don't have this fork in the road where it's like one sign says success and one sign says failure, and we just walk down the failure road anyway. It's not obvious in the moment, but we're so good after the fact at dissecting every choice. And I know I do, like, just this was all my fault. I could have done a million things differently, and now it's permanently ruined.
mm-hmm.
And it's so hard to get out of that.
Absolutely. What you're talking about a little bit is called the negativity bias. Our brains exaggerate negative experiences and our failures and our downfalls and our pain and our hurt. It almost projects those on a big screen in front of us because it's our brain's mechanism. It's a faulty mechanism, but it's a mechanism to keep us safe. It will then dissect everything that happened as a means to protect you from it happening again. But the faulty wiring is that then we become perseverative on it, we ruminate on it, and then we start to superimpose the things that we thought went wrong into our environment. And it's hard for us to break from that.
Right. And in certain situations, I think of like having brunch with your friends after a crazy weekend and like what went well, and let's talk about who we're dating, and is it
Mm,
red flags or green flags? Like those are helpful conversations to have, right? Like we're trying to put ourselves in good situations, but yeah, when something really bad happens, it's hard to snap out of that.
mm. It is, and that's honestly that's where I come in. When it gets bad enough to where people are impatient. But yeah, when people get so stuck in those thoughts, those pathways in the brain, they get so hardened almost. And the goal is to try to loosen that up. And it's not just medications, obviously, but talking about that experience, therapy, friends, doing things that make your heart smile. It's as kind of lame as it sounds. They all work.
That's good. So what do you do to like sort of wash off the day, cheer yourself up?
Yes, yeah. I am learning better how to do that now. I thought that I really had a good lock on it, and then that patient had just passed, and um, negativity bias took off for me, and I was then going over every decision for every other patient with a fine tooth comb, too much so, and I was before I know it checking my work phone at home. I'm logged on to Epic, like our electronic medical record. I'm looking at meds. It was my first thought in the morning. It's my last thought at the end of the day. So I thought I had a much better handle on it than I actually did. So TBD. I'm in the process of learning more better boundaries.
Right.
Um, my boyfriend now, who's lovely, was able to kind of point that out a bit more, and it feels so elementary for somebody who's been in mental health for my God, almost 10 years now, to be like boundaries. Like, what do you? How dare you? Like, I invented boundaries. And then to be like checking Epic on my phone at night, like, no, dude, like put the phone down, cut that shit out, take a shower, brush your teeth, wash your face. Yeah, so I'm still learning.
Yeah. I mean, that's good. It's honest and it's a practice. It's like anything, right? We just have to try to stay positive, try to compartmentalize, try to
It's
make it
yeah,
the next day.
it has a bad connotation, compartmentalize, but it's almost necessary in some instances.
I think it can be good. I mean, I've definitely had
Yeah.
situations where I'm having a bad day and like maybe I'm on the phone with a family member like crying about something, but then I have a work call and I'm like, "Hi," ready,
Yeah, no, that's very
you
true.
put your work hat on and then the call's over and then I'm back on the couch being sad.
I'm crying again. Yep. Yeah, it's called balance. So.
Right. So it's nice. I mean, it can be good because then for like that hour, you're like, well, I'm happy for an hour.
Yeah.
I don't have
Yeah.
any problems for an hour. I just have to do my job.
I just have to do my job.
Yeah,
That's it.
that's great. So, and before this career, you had a career as a psychic.
I did.
So
Yes.
tell
Yes.
everyone about that.
So I had gone back to Tucson, Arizona to do my second bachelor's, and I was this actor who was no longer an actor, singer who was no longer a singer, with very little skills, trying to like do a career change, and I needed money. So I was like working at Bath and Body Works, and I met a really good friend, our mutual friend, who we had a very amazing coffee date when I moved back to Tucson, and she had been embarking on her psychic journey. She had a psychic awakening, kind of later, well, not later, like I mean, in her 20s, and she was kind of intuiting from me. She was like, "This has been a part of your life," and when she'd said that, I was like, "Yeah, like I've read tarot cards, or like I've had dreams or whatever," but I never really paid a lot of attention to it, or rather I did when I was younger, and then it freaked my parents out, so I didn't do anything with it for a long time. But this friend was really instrumental in giving me confidence to start to look into this. So I started to look more into tarot. I had already actually learned how to read tarot. My aunt, my godmother taught me when I was younger, um, and I started to be like, well, I can read tarot cards. Maybe I should do this like to make a little bit of money. So then I found different farmers markets around Tucson that would let me put up my little booth, my little curtains and little lights, and I would be at different fairs and festivals, as you know.
That's how I met you. Yes.
reading tarot cards, just slinging the
Yeah.
cards, and it was great because it reminded me of this part of myself that it was kind of dormant for a while, and then like the long short of it was I did it so much for a private party one day that something kind of clicked. Then it was very hard for me to shut off. I was having a lot of anxiety. It was manifesting in my body very physically and mentally, like to be out in public. It was hard for me to be around other people. If people were having too many emotions, like I felt like I just was picking up everything, but so much so that nothing was making sense. So it was difficult. And I then um, went to a psychic fair of like psychics that were in Tucson, and I met my mentor. Her name was the late great Jane Siebold. She passed not too long ago. But I sat down with her, and I was like, "Hi." I was like, "I think I need your help," and she goes, What's going on with what's happening?" And I kind of gave an explanation, and she was like, "You're bouncing in between the world of like the physical world and the spirit world, and you can't put yourself in one or the other." And I was like, I was like, "Could you help me?" And she was like, "Reach out to me, whatever." And so she ended up taking me on as a mentee for a couple months, and then trained me how to like lock it down.
Right. Because I remember talking to you when you were doing a lot of psychic readings and working with clients and just talking about, energetically the toll that it did take on you.
Absolutely. I wasn't realizing how much of our energy, or anyone who's in that kind of like intuitive space, how much of our energy is just right out there on the line. we're almost sometimes, conduits in a sense for people's energy to come through, whether it's just like stopping by to be like, oh, I'm picking up on something, or whether it's like an energy healer who is then utilizing that energy to transmute that energy, that lower vibrational stuff, into higher vibrational stuff. Like your energy's right out there, like right out there in the open. So doing a lot of that work was difficult because I had poor boundaries. Is the thing. Poor boundaries with allowing my energy just to be so quickly utilized, and then not kind of letting myself remove that energy. I felt responsible to people sometime to help them. Always wanted to help people.
Right. Did you ever like just get messages about people or for people that you felt like you needed to tell them about?
Oh my God, yeah. It was right before my menteeship, and then after. So like at that like sweet spot that like everything was coming through like constantly, and I felt pulled, and I did read people in public, like frequently. Like my ex would, and he would just know. We'd be sitting there at the table, and I guess I would kind of get this look, and I would be totally zoned out for a second, and then I would just know, or I would just know, like so, like their friend passed, or so that this thing passed, or this thing happened, and he'd be like, just go, like I know you're gonna just go over there at some point, and 9 times out of 10, yeah, it was someone that they've been needing the healing from. In the end, it was the pull from spirit to please deliver this message, because this person and my spirit could really utilize that healing. And yeah, in the line at Slotsky Subs, at the grocery store, at Arizona Beer House.
That's wild. You
Yeah.
did a tarot reading for me one time, and at some point in the reading, you were like, there's a woman who sleeps in your bedroom. And I was like, nope.
She does not. We're ending this here.
I was like, keep it going. I didn't even ask. I was like, no follow-up questions. Like,
Didn't ask. First of
no.
all, didn't ask. Second of all, moving on. Yeah, yeah, yeah. Spirit will sorry, will come through with like messages like that at very interesting times. Like, because I still offer readings. Like I got reached out by a client today, inquiring about a reading, and I offer two different ones, which really is no different. It's just basically like, how much of your energy do you want me to have access to? If you
Yeah.
want me just your energy, read your energy system, do some tarot, past, present, future stuff, or do you want me to try to connect with spirit? Like, but regardless, sometimes if spirit's coming through, spirit's coming through. Like, if
Yeah.
it's guardian angel stuff, it's someone that you knew in this life, doesn't matter. They will knock, knock, knock until what? Tell her I sleep in her room. She doesn't want to hear that.
Didn't want to know. I probably should have asked you, but it's such a like crazy.
I know.
I should have been like, oh, that's interesting. Tell me more. But I was just like,
No.
nope.
How energetically irresponsible of me to put that on you. Sorry.
No, it's like, it's so funny because I was just like, it's a thing. It's like someone was like, oh, there's a ghost over there. It's like, do you look? Or do you just go, if I don't see it, it's not there.
If I don't see it, it doesn't see me. So we're
Yeah,
just gonna.
it's not a big deal. Right?
Yeah.
That's so wild. And do you feel that when you interact with patients, do you have a little bit of a sixth sense about maybe what's going on with them beyond just your clinical training?
That's a great question, and that's kind of the juncture that I'm coming to right now. I feel like when I was in for most of my life, and from when I was in Tucson, really honing in on it, that my focus was psychic work, getting in touch with that spiritual side of me, getting those boundaries up in those situations, learning what my intuition was, learning to trust what was coming through. I was very focused on that, like boot camp for a while. But then when I got into nursing school, and especially when I got into DNP school, I cannot make clinical decisions based off of a feeling.
Right.
I cannot make decisions on somebody's life and their health and their wellness based off of a based off of a an intuition. Like there is a level of intuition. So have severely dampened that down a lot to where when it starts to come through, I put up the boundary for spirit, my own kind of spirit team, to be like, I do not receive information at work. Full stop. Like, I don't care how important the information is. But yeah, there is always a trickling. It's like a sieve, like, or like a sieve with not as many holes, whatever. Like, there's a trickling through of information that is just how I work through the world, like how I work through life.
Right.
And as long as I can have concrete evidence off of what my patient tells me, what I'm seeing, what collateral tells me, to then base my feelings, my intuition, then I'm good to go. But it is a very interesting balancing act that I'm coming into now that I'm still kind of figuring out.
I'm sure. And I think we all do that a little bit in the world. I mean, we all have times where we sense that something's going on with someone, but it's not really appropriate to bring it up, or like it's clear that they're masking and that they just want you to see them as like someone who's doing well, so you do that favor for them, right? Like,
Mm-hmm.
oh, you look great. Like, let's go get a pretzel. Like, don't they, like you can tell when someone's like one tear away from the dam bursting and like everything rolling out of their eyes, and you're like, what's that over there?
No, yeah, help them to protect their peace in that way.
Yeah.
Unfortunately, I'm the one who's trying to break the dam down to be like, "What's under there? How can I help you?" But yeah, as far as intuition's concerned, you're absolutely right. Like, it's we all have it, and I feel part of my kind of unique journey in being a psychic and a psychiatric nurse practitioner, is to kind of maybe hopefully blend these kind of two different schools of thought, because on paper they're so different. They look different, they sound different. People on both sides of that spectrum have different feelings about who's on the other side of that spectrum.
Right.
But in the end, I wholeheartedly believe and I feel we're speaking the same language. What you call, what this side calls intuition, I call feeling. With what this side calls, a hunch, I call, you know, like message from spirit or whatever. It's all energy, all speaking the same language. We have a lot more in common, especially with in psychiatry, than we have that's different.
I love that. So, what would you tell someone who is considering getting into a similar program, how to decide if it's right for them, how to get through the difficult periods?
Absolutely. I think my MSN, my master's program, was accelerated. So just be prepared to drink through a watering hose. It's a lot of information fast, and in those periods when you feel that it's hard to go on, you take it one step, one day at a time. Celebrate little victories. When an exam's done, put the material away for the rest of the day. Go treat yourself to something. Go get ice cream. Go see friends. Go get a drink. Like, do something that gives you that balance to keep moving forward. And for anyone who wants to go into a people helping profession, when it gets especially hard, remember why you got into it. Remember that hopefully the goal was always to help people. Um, and I'm not going to dog anyone who maybe wants to go in for especially psychiatry could be kind of cushy, kind of flexible. We're most likely the profession, the specialty that works remote. I don't, but you can, and that's fine. But the more of your heart that you can give to what you do, the more longevity that you'll have in doing it. And I'm not saying your passion has to be what you do. I believe people need to have passions away from work, but there needs to be, I feel that core want to help in some way, if you want to go kind of the distance, because it's
Right.
tough. It's tough to take that on.
Yeah. No, that makes sense. I mean, you have to be pulled by a calling and your values and that desire to do good, because it sounds like a very difficult profession.
Mm, very difficult and very rewarding. Yeah, for every chair that's thrown at me, for every time I'm called it, oh, I swore a couple times. I'm sorry. For every time I get called names and I don't want and people don't want me to work with them. More often than not, it's usually those patients in the end that are the most rewarding. That one that did throw a chair at me, and said that, hugged me at the end of her hospitalization. She said thank you. Like she didn't, and that's the goal. That we do work well enough to where you gain a little insight into your illness and you have um, motivation to continue to make good decisions for yourself and to be safe. And hopefully, if you lead with that the entire time, unwavering, I don't care how sick a person is, how unwell someone is, they will see that. They will know your intention.
That's fantastic. I love that. And I love that you came to this career after trying a few different things. I think everyone I've interviewed so far has done multiple, iterations of their careers, whether it's sort of building on one thing to get to another thing or just completely shifting gears. And I think
Mm,
that's really powerful for people to hear because I think we all tend to think that you have to like get on the train and stay on the train until you retire. And
mm.
for most people, I'm finding that that just hasn't been the case.
100%. I'm so privileged and fortunate to have been able to have these not really lateral moves, like I guess lateral huge moves. Like I'm not within the same space. I've gone into something completely new. But I would encourage anyone who feels stuck, unfulfilled, don't really feel like there's a lot of growth or something. I don't care how old you are. Like, and I know I was the person who was being like, I don't want to be in med school in my 30s. Like, it's a grain of salt, but you can do anything you want. Follow what your passion is. Follow what your heart's telling you. You don't have to work. You don't have to live to work. You can find a job. You can work to live.
Right. Great advice. All right. And how do people find you if they're interested in learning more about you?
I don't have it. I don't have any social media.
Okay, I'm not taking on any clients.
I know. I don't have social media. I
You're like,
mean,
if you have a nervous breakdown in Manhattan, maybe you'll run into me.
maybe you'll run into me. Absolutely. I'll give an email address, if you
Okay.
want, if you want to put it in a chat when this thing's posted. And yeah, if anyone has questions about um being a nurse, being a nurse practitioner, psychic stuff, want to chat, yeah, I'd give an email address.
Perfect. Yeah, I'll have people DM me.
Excellent.
Amazing. Well, thank you so much for your time. You are so awesome, and it's amazing to see you. And
Yeah.
you're doing so much good in the world and in New York especially, so thank you for doing that.
Yeah, and thank you. Thank you for this opportunity and for putting out, these all these different careers in this kind of way is so cool. I'm proud of you too.
Of course, everyone is interesting and everyone is a celebrity.
Like we are the main characters of our stories,
We are
that's
all
for
the main
sure.
characters of our
But
story.
are we good TV?
We try. We strive. Well, thank you, Brandon. I'll talk to you soon.